We hear it all the time, right? HIV affects everyone differently. But today, we're focusing on men, specifically the signs of HIV that men should be aware of.
It's a good point. Even though the basics are the same, there can be some subtle differences.
Exactly. And to make sure we're giving you the best info, we're diving into this text excerpt we've got all about the medical side of things. So we'll break down the stages of HIV infection, explore those symptoms, and make sure everyone listening feels empowered to prioritize their health.
That's key, isn't it? That's why understanding those stages is so important, Not just for your own health, but because it even affects how likely you are to transmit the virus.
Okay, so let's jump right in. Stage 1, the acute HIV infection phase. This is the initial stage, usually popping up about 2 to 4 weeks after exposure.
Yeah, and a lot of people, they just think they've got a nasty flu.
I can see why. It really does mimic those classic cold or flu symptoms, doesn't it? You get that fever, fatigue, those oh-so-fun swollen lymph nodes.
Exactly. But then there's this curveball, you might get mouth sores. Now, that's not your typical cold symptom. And on top of that, this stage is actually when you're most likely to transmit the virus.
Because of the viral load. Right.
Exactly. The amount of virus in your blood, that's your viral load, it's at its highest during this stage.
So it's like, bam, the virus is making a grand entrance.
Pretty much.
Okay, so we've got this dramatic start with stage 1. Then things get a little stealthy, right?
Yeah.
Stage 2 is the clinical latency stage, or you might hear it called chronic HIV infection.
Right, and this is where people can really start to feel like everything's fine. They might not even know they have the virus.
That's what makes it so dangerous. You feel good, but you can still transmit it.
And this stage, it can drag on. We're talking years, sometimes even decades. That's why it often gets called silent HIV.
Silent but deadly.
Right. Well, not always deadly, especially with treatment these days, but it's definitely deceptive. You might not have any obvious symptoms, or you might have little things like those swollen lymph nodes hanging around, maybe some unexplained weight loss or getting sick more often than usual.
So those silent symptoms, they're the real red flags here.
Absolutely. It's like your body's trying to whisper a warning.
We've got to learn how to listen to those whispers. I remember reading about a guy who ignored swollen lymph nodes for years, thought it was just allergies. Turns out it was HIV.
Wow.
Scary, right? Okay, so now we're at stage 3. This is where things can get really serious if HIV is left untreated. We're talking about AIDS-acquired immunodeficiency syndrome.
And that's when the immune system really takes a beating. Your body becomes much more vulnerable to infections that wouldn't normally be a big deal.
Opportunistic infections, right? They see a weakened immune system and they're like, let's go.
Pretty much. And that's why the symptoms in this stage can be so severe. We're talking about rapid weight loss, chronic diarrhea, those persistent fevers.
It really highlights the importance of early detection and treatment.
Absolutely. Catching it early can make a world of difference. In fact, with the right treatment, a lot of people with HIV, they can live long, healthy lives. They might never even progress to AIDS.
And that's what we want to emphasize. This is not a death sentence anymore.
Exactly. It's about knowledge, taking control, and understanding that things have come a long way.
Okay, before we move on to the hopeful stuff treatment, living with HIV, there's one more symptom we should touch on that can pop up in stage 3, Kaposi's sarcoma.
Yes. This one's kind of unusual. It's a type of cancer that can show up as these purple or red lesions, often on the skin, but it can be in other places too. It's not just an HIV thing, but it's definitely something to watch out for.
It's almost like a medical mystery, right? The way it presents is so unique.
It is.
Okay, so we've covered some big symptoms already, but our source actually lists a bunch more. We're talking about things like changes in skin color, severe headaches, even nausea and difficulty swallowing. But here's the thing, all these symptoms, they could be caused by a lot of other things too, right?
Exactly. That's why we always say testing is the only way to know for sure.
You can't just Google your symptoms and play doctor.
Nope. It's
Oh.
about getting that professional confirmation.
Knowledge is power, but it has to come from the right source. Now, speaking of knowing more, let's move beyond the symptoms and talk about testing and treatment options. There have been some incredible advancements in HIV care, haven't there?
They really have. It's amazing what's possible now, with the right treatment and care.
It is.
Yeah.
But knowing's only half the battle, right?
Yeah.
You've got to actually use that knowledge. We've talked about these stages and symptoms, but what's someone supposed to do with that info? I mean, if someone's listening, maybe thinking, okay, this is good stuff, but where do I even get tested?
That's a great point. You've got to know where to go, what to do. The good news is you've got options. Your regular doctor, they can run an HIV test. And there are tons of clinics out there, community health centers. A lot of them even offer testing for free, or it's super affordable.
But all about accessibility,
Oh,
right?
yeah.
Making sure everyone can get tested without any barriers.
Exactly. And, there are even those at-home test kits now.
Oh, yeah, those are becoming really popular. It's like right at your fingertips.
Exactly. So no excuses, right?
Right. So I'm curious about something. How often should someone get tested? Is it a one and done kind of thing or what?
Good question. The CDC, they recommend everyone between 13 and 64 get tested at least once, just to establish that baseline.
Okay, so everyone should get that baseline test. But what about if someone's like more sexually active? Or if they have other risk factors, like sharing needles?
Then, yeah, more frequent testing is a smart move. Think of it like, getting your cholesterol checked or going to the dentist. It's just being proactive about your health.
Makes sense. It's about staying informed and staying on top of things. So speaking of being proactive, let's shift gears a bit and talk about prevention. I know HIV is transmitted through certain bodily fluids, blood, semen, vaginal fluids, breast milk.
Right.
So what are the most effective ways to, prevent transmission in the first place?
Well, abstinence, obviously, that's the most foolproof way, right? But for those who are sexually active, condoms, they're incredibly effective at lowering your risk, if you use them correctly and consistently, that is.
It's a simple but powerful tool. And it's not just about preventing pregnancy.
Exactly. Condoms help protect against HIV and a bunch of other STIs.
And it's like a win-win, really. And in recent years, there's been this game changer in HIV prevention, pre-AP. Have you heard of that?
Oh, absolutely. Pre-AP, that's pre-exposure prophylaxis. It's a daily medication, and it can seriously reduce your chances of getting HIV. Like, studies show it's over 99% effective in preventing sexual transmission, if you take it as prescribed, that is.
That's amazing. It's like having this extra layer of protection.
Eh.
But it's not for everyone, right?
No, not necessarily. That's why it's super important to talk to your doctor. They can figure out your risk factors and see if PEP is a good fit.
Got it. So it's a personalized thing. You've got to have that conversation with your doctor to make the best decision.
Exactly. And then there's PEP, post-exposure prophylaxis. That's for, situations where someone might have been exposed to HIV, like maybe unprotected sex or a needle stick injury.
Right. So it's like an emergency option.
Yeah, basically. It's a short course of medication, but you got to start it ASAP after a potential exposure, ideally within 72 hours.
So time is of the essence.
Absolutely. The sooner you start PEP, the better it works.
So if you think you've been exposed, don't wait. Get medical help right away.
Couldn't have said it better myself. We've talked a lot about the medical side of things, stages, symptoms, testing, all those different ways to protect yourself.
A ton of info.
Right. But we can't forget about the other stuff that comes with living with HIV, the social and emotional stuff.
The human side of it all.
Exactly. There's still so much stigma surrounding HIV, which can make it really hard for people to even talk about it or ask for help.
That stigma, it's like this invisible wall. It can be so isolating.
It is. And it often comes from fear and misinformation.
Old-fashioned thinking.
Yeah. We need to change that. People living with HIV, they deserve our support, not our judgment. They're just people navigating life just like everyone else.
Exactly. And we've got to recognize how incredibly resilient they are. They're out there living full lives in relationships, with careers, with families. HIV is just one part of who they are, not their whole identity.
Well said. It doesn't define them. They're living proof that with treatment and support, you can thrive. You can have a long, healthy, meaningful life. And that brings us to another key point where can someone turn if they need help?
Right. Where do you find that support?
Well, there are tons of amazing organizations out there. The CDC website, that's a great starting point. They have links to local and national groups offering all sorts of services. Counseling, testing, treatment, support groups, you name it. Don't underestimate the power of connecting with others who get it.
Sharing stories, getting advice, just having someone to listen, to understand.
Can make all the difference. Remember, you're not alone. There's a whole community ready to support you. So reach out, connect. Knowledge is power, but connection is strength.
I love that. Connection is strength.
Yeah.
That's so true. This has been such a powerful deep dive. We started with the science, the facts, the technical side, but we've also touched on the human side of HIV, the emotions, the challenges, the resilience.
It's been great exploring all this with you. Hopefully we've shed some light on this topic that affects so many lives. I mean, we've covered a lot. Symptoms, stages, prevention, treatment, testing, and now the importance of support. But now I think it's time to get a little more personal. What do you think?
I like where you're going with this. We've talked about the science, the medicine, but What about the actual experience of living with HIV? The challenges, the hopes, the dreams. I think it's time to bring in a human voice, to really make this all hit home.
Totally agree.
Right. We're not just talking about a virus. We're talking about people's lives.
Exactly.
So, to all our listeners, stay tuned. We're going to bring in a fresh perspective, someone who can share their own story about living with HIV. This conversation's far from over. All right, welcome back, everyone. It's great to have you back for the final part of our deep dive into HIV. In part one, we got into all the nitty-gritty details about the virus itself, right? The different stages, those key symptoms you should watch out for, and of course, all the incredible progress we've made with treatment and prevention.
Yeah, it's amazing how far we've come. And in part two, we got into the practical side of things, where to get tested, the importance of those regular checkups, and all the ways you can protect yourself and your partners. But now it's time to get real, to hear a story that puts all this info into perspective.
Exactly. We talked about having a guest on, but we realized, hearing from you directly with all your expertise and the stories you've encountered that could be even more powerful.
I appreciate that. And you're right, sometimes just hearing one person's experience can make everything click. It reminds us that behind all the statistics and medical terms are real people living with this virus every day.
Yeah, it humanizes the whole thing.
Mhm.
So I was hoping maybe you could share a story, something from your work, that illustrates what it's like to live with HIV today. Obviously, respecting confidentiality and all that.
Of course, of course. And, while every experience is unique, there are definitely some common threads that weave through the stories I've heard. There's one patient in particular I'm thinking of. Let's call him Michael. Michael was diagnosed in his early 20s, and like a lot of young people, he was scared, confused, and just felt incredibly alone. He never even thought about getting tested before, because HIV always felt like something that happened to other people, not to him.
It's easy to fall into that trap, right? Especially when you're young, you feel invincible. So what happened to Michael after his diagnosis?
Well, at first it was all denial. He even refused treatment for a while, just couldn't accept it. It took time, support from a therapist, and eventually connecting with a support group to help him process everything and see a path forward.
That support system sounds crucial. And you touched on this earlier, the stigma surrounding HIV can be such a burden. Did Michael face that too?
Absolutely. He was terrified to tell anyone, afraid of judgment, rejection, discrimination, the whole nine yards. He kept it a secret for a long time, which only made him feel more isolated and ashamed.
That breaks my heart. People isolating themselves out of fear when what they really need is understanding and connection.
Exactly. It's a vicious cycle. But eventually, Michael did open up to a few close friends, and to his surprise, they were incredibly supportive. They helped him navigate all those emotional ups and downs, encouraged him to prioritize his health. It really made a difference.
That's incredible. It really shows how important it is to break down those walls of silence, those feelings of shame. Did that openness lead to any other positive changes for Michael?
Oh, absolutely. He actually became an advocate for HIV awareness, started sharing his story at events, even volunteered at the clinic where he got his care. It was amazing to see him turn his experience into something so positive.
That powerful, turning pain into purpose. It's a reminder that so much strength and resilience can come from being vulnerable, from sharing our stories.
It really can. Michael's story, it's a testament to the power of knowledge, support, and ultimately self-acceptance. He learned to manage his condition, built a strong support network, and found a whole new sense of purpose in helping others.
It's truly inspiring. So even though we didn't have a guest on today, I feel like we still get this incredibly powerful story, and it really ties everything together, doesn't it?
Yeah,
All those things we talked about.
it does. We talked about the different stages of HIV, the symptoms, testing, treatment options. But Michael's journey shows us that this isn't just about the physical aspects of the virus, right? It's about the emotional, social, even spiritual impact this can have.
We started this deep dive by saying HIV affects everyone differently. And Michael's story is a perfect example of that. There's no single experience.
That's right. And it reminds us that compassion, empathy, understanding, those are just as important as medical knowledge when it comes to HIV.
Absolutely. Well, we've covered so much ground today, from the technical stuff to the personal stories. If there's one thing I hope listeners take away from this deep dive, it's this. Knowledge, compassion, and action. They're all essential.
I agree. Knowing the facts empowers us to protect ourselves and others. Compassion lets us approach this issue with empathy and understanding, breaking down stigma and creating a more supportive environment.
And action. That's what makes it all real. Getting tested, talking to your doctor about prevention, even just reaching out to someone who needs support. It all matters.
So everyone listening, don't just let this information sit there. Use it. Learn more, get involved, make a difference.
Beautifully said. That's a perfect note to end on. Thank you for joining us on this deep dive into HIV. Remember, knowledge is power, compassion is strength, and action is key. Stay curious, stay informed, and stay well.